I mentioned that we're also just going to talk about why engagement in a little bit more depth. And so high level, and we've got a couple more frames on this, but when we think about in a Medicare audience in particular, that cost or risk of attrition, we know that we have to resell every member every year. And if that experience is a negative one, then we've got challenges with that. So, those unengaged members really being dissatisfied is something that we have to keep a really sharp pulse on. And as we look at some of the data, this is from a JD Power survey from a few years ago, but overall member satisfaction can really increase just based on the communications that we're sending and the thoughtfulness of those communications. And when I think about myself as a member of a health plan, and if I were on, say, just an individual market and maybe making that decision on an annual basis, if I were going to stay with a plan or not, of course, I need to look at things like what's in network and what's not, but so much of my motivation to leave is a function of, did I have a bad communication experience? Those are the things that I'm going to remember. So doing some of the things like providing nice education resources, making sure that I understand what my financial input is to being a member with a health plan, and then also making sure that those most useful services are at my fingertips. Even if I don't utilize all of those things, being communicated with in a way that makes me feel confident is a place that helps me stick with that brand.